We're here to let you know that late yesterday we had our first case of a novel coronavirus confirmed in a person here in British Columbia through the work of the BC CDC Public Health Lab. So this person is a male in his 40s and a resident of the Vancouver Coastal Health Region. He regularly travels to China for his work and was in Wuhan City on his most recent trip. He returned to Vancouver last week and had onset of symptoms after his return. On this past Sunday, he followed public health messaging. He was assessed by a primary care provider, and a test was done. The protocols were followed in that the medical health officer was notified. The test came here to the lab here at the British Columbia Centre for Disease Control, and late last night, we had a confirmation of a presumptive positive here in BC. So I say it's a presumptive positive because our protocols are that the confirmation is done by a second test at the National Microbiology Laboratory in Winnipeg, and the sample is on its way to Winnipeg even as we speak, and our lab here has been in contact with the Winnipeg lab. But given the history of travel, the contact that this person had in Wuhan City and the symptoms they were showing, we are confident that this is truly a case of this novel coronavirus. So Vancouver Coastal Health has been in contact with the family, has been in contact with everybody who needs to be around this case, and is following up with the person and a small number of contacts on a regular basis. The person is doing well and is in isolation at home.
I think other jurisdictions are working as we are on this question now, and we're working very closely together. Last Friday, all the health ministers in the country met over the phone with the federal health minister, and obviously officials are meeting on a regular basis. The health officials are meeting with all the other provincial health officials to make sure the standard across Canada is high. And as I say, I want to express it again, how proud I am of the response of people here, what they do, their caring for the issue, their sensitivity to it, and their understanding of the public concern. And I think we've shown that in the previous things, and I think that builds and should build confidence in their response.